Hello friends, good morning. Today I am going to tell you about a very important and common disease, irritable bowel syndrome, popularly known as IBS. Now, IBS is a disease of large intestine. So, inside our abdomen, we have two kinds of intestine. Small intestine, which has a small size. It is very long, but the size is small. And one is a large intestine, which is huge, right? Now, this large intestine will be in four quadrants. For example, it starts from here. There is appendix, then goes up, and then this way, and then this way. It comes down, joins to rectum, and then the motions are passed from there. So, it is a disease of large intestine, and basically, it is a hypermotility disorder. Means where your intestine becomes hypermotile. Now, the biggest problem of this disease is that it recurs with the slightest trigger. Now, let me tell you first symptoms of this disease. It usually presents with either constipation or diarrhea or gases problem or recurrent abdominal pain. Right? The most important triggers for this, by which this disease is sparked or triggered, is food, emotion. Then any kind of stress can trigger this. Stress is very important cause, and stress will be, I will say, the commonest trigger. You may know or may not know it, but stress will be the commonest trigger, and scientists have now associated this IBS as a psychosomatic disorder, meaning that this is related with mind. So one causation is a stress. Another causation which can be possible in this case is the hyperactivity or hypersensitivity of the nerves which innervate or which supply to the large intestine. So if these nerves become hypersensitive, your intestine will react to the slightest stimulus which nobody's intestine will react. So this becomes the commonest source of the problem, right? What are the risk factors? Usually this is present in young, below 50, stressed up, type A personality, below 50, young population is the very common, are all these common risk factors, but the most important is the family history. Now the presence of family history as the important risk factor indicates the genetic tendency present. And so basically if we see all together, irritable bowel syndrome becomes the combination of the genetic factors as well as the mental factors. So there are few genetic factors plus the mental factors which may act as a causative agent or which may act as a maintaining factor, right? So the treatment aspect now, investigation aspect, if we have to be very precise and specific about it, there are no specific diagnostic indications. All the investigations are vague, and diagnosis is usually on the basis of clinical acumen. You need to go to the proper doctor, or proper specialist, or somebody who really knows this disease to get diagnosed. So investigations will not support much. So please trust your doctor. Don't see that MRI is not showing irritable bowel syndrome. It will never ever show, right? So the diagnosis is basically clinical. There are few blood investigations which can, for example, shows increased raised ESR. But ESR is not a specific thing, so don't go for it, right? Investigations are basically not to confirm irritable bowel syndrome. They will be done, but to rule out other diseases like Crohn's disease as well as ulcerative colitis, right? So investigations will be done to rule out other diseases rather than rule in or diagnose irritable bowel syndrome. Now coming to treatment aspect. Now treatment aspect, if we see the irritable bowel syndrome as a complete disease syndrome, it doesn't have any reliable cures. It's a disease which can be controlled. It is a disease which can be symptomatically controlled on the basis of anti-motility medicines, right? There are some anti-motility medicines which are given. Then anti-anxiety medicines are also given to control this. So this is another medicine which can help. But now the problem starts here. these medicines will help temporarily. So a problem is chronic and going to stay with you lifelong, and these treatment modalities will help you temporarily. So these are good. Take these medicines, go to specialists, take these medicines till you find a better treatment. Because you need to find a better treatment, because if continued for long, this results into complications of irritable bowel syndrome. Yeah, it leads to so many complications. The first and foremost being poor quality of life. Yes, it affects the quality of your life, and you happen to compromise your life on so many occasions. Those whosoever is seeing this having ulcerative colitis, he will agree with me that his lifestyle is completely changed, and the happiness and enjoyment of life has been drained by these symptoms of irritable bowel syndrome, right? Another thing which is very common in irritable bowel syndrome patients is the mood disorder. As I always said, as I already told you, that it is related with mind and mental traits. So the mood disorder is another common coexisting symptom or a complication of irritable bowel syndrome, right? So you must be wondering, is there really any permanent solution for it? Definitely there is a permanent solution, and I am going to tell it step by step. Please note it down. We say genes is the cause, family history and genes. Another important cause is mind. If by some method you can reprogram your genes and mind, the cure is possible. And good news is that, I'll say the great news is that rewiring and reprogramming of your brain, mind, as well as genes is possible. The science of epigenetics have made it possible, and we are treating such kind of cases with the advanced genetic based treatment with amazing results. So if you want to find a doctor, try to find a doctor who can work on genetic tendencies. You can find some homeopathic doctor, a good homeopathic doctor who is doing the highest level of classical homeopathy. He can definitely work on these tendencies and give you an amazing life. Then comes mind. See, mind is like, I will say, it's very naughty monkey. If you don't control it, it will control you. And if mind controls it, it will make you dance like anything. So there should be something to control your mind, to reprogram your mind, to rewire your mind to suit or to help the reversal of this disease or cure this disease. But take my word, cure is possible. Don't get disappointed. Take these genetic based treatments, mind reprogramming treatment, and you can definitely live a good life, a good social life, a disease free life. I am not talking of control. I understand the value of your life. I understand the value of your goals. I understand the value of your, I will say, business life, functional life, right? So don't underestimate that value, and don't treat this disease, irritable bowel syndrome, only temporarily. So I recommend you should look for a curative treatment. You should look for a long lasting results. You should look for reversal of irritable bowel syndrome, and not just be satisfied with the control of disease, right? So if there is any further question on irritable bowel syndrome, you can write these questions in comment box, and I will definitely love to answer these. So you can go to my YouTube videos, other videos also. I have told about so many diseases, but as far as irritable bowel syndrome is concerned, take my words, it is curable and reversible. Your questions are welcome. You can share this video to somebody who is having irritable bowel syndrome, or whose family is having irritable bowel syndrome. He may get benefited by your simple click and share. Right? Thank you.